erosion of government revenues by eliminating so-called tax havens. But what about the poorest nations in the world? Yellen says, well, the first step is guiding them out of the pandemic.
So how do we help the poorest countries get through this crisis? Our first task must clearly be stopping the virus by ensuring that vaccinations, testing, and therapeutics are available as widely as possible. Low-income countries risk falling to the back of the line and may not achieve widespread vaccine coverage until 2023 or 2024 at the current pace.
Now, that help may not be far off. U.S. Secretary of State Anthony Blinken says America is ready to help.
Moreover, we want to rise to the occasion for the world. By helping bring to a close one of the deadliest pandemics in human history, we can show the world once again what American leadership and American ingenuity can do. Let's make that the story of the end of COVID-19.
Blinken says people here at home have to understand to keep Americans safe from COVID, the whole world has to be safe from COVID.
Even if we vaccinate all 332 million people in the United States tomorrow, we would still not be fully safe from the virus. Not while it's still replicating around the world and turning into new variants that could easily come here and spread across our communities again.
Blinken says the U.S. will not seek favors in return for any international assistance it offers. Let's take a look at those COVID-19 numbers now. They're provided by the Coronavirus Resource Center of Johns Hopkins University in Medicine. As of 6 p.m. Eastern Time today, the number of cases of COVID-19 reported worldwide, now more than 131,576,000. Top three on the list of countries with recorded cases: the United States with more than 30.7 million, Brazil more than 12.9 million, India more than 12.5 million, and sadly, more than 2,856,000 lives worldwide have been lost to this virus. The top three countries with the most number of COVID-related deaths are the United States, more than 555,000, Brazil, more than 331,000, Mexico, more than 204,000. In the United Kingdom, Prime Minister Boris Johnson easing more restrictions starting next week, next Monday. Pubs, restaurants, and the like can reopen for outdoor service. And as well, non-essential retail stores, gyms, and hairdressers, they can resume business as well. But Johnson is being cautious about allowing the resumption of non-essential international travel.
Obviously, we're hopeful that we can get going, but from May the 17th, we're hopeful. But I do not wish to give hostages to fortune or to underestimate the difficulties that we're seeing in some of the destination countries that people might want to go to. We don't want to see the virus being re-imported into this country from abroad. Plainly, there is a surge in other parts of the world, and we have to be mindful of that, and we have to be realistic.
Johnson isn't talking about so-called vaccine passports for international travel, and he rules out any kind of certification that would have to be produced to attend events or access services domestically, at least for the time being.
There is absolutely no question of people being asked to produce certification or COVID status report when they go to the shops or to the pub garden or to the hairdressers or whatever on Monday. So and indeed we're not planning that for step 3 either.
Johnson adds vaccine passports is something that all countries are looking at, and he admits they could be required for travel in the future. Let me bring you up to date now on the military coup in Myanmar. Protests continuing. More than 560 civilians have died in military crackdowns since the coup began on February 1st. In the state of Karen, residents hiding in the jungle Thousands have fled their villages, which have been targeted by the military. They're trying to shield themselves from airstrikes after they were denied entry into neighboring Thailand, where they sought refuge. But back in their own country, they seek shelter wherever they can find it, hiding under the cover of the tropical forest. The images of children crouched inside holes in the ground, the only way to describe it is heartbreaking. Elsewhere, protesters rode motorbikes through the countryside to avoid clashing with security forces. They took to small dirt roads and demanded the release of detained leaders and protesters. And to escape reprisals from demonstrators, or from the military, demonstrators are finding new forms of protest every day. Here, these people took to the streets to cheer those who have taken a stand against the junta. In this latest sign of defiance against military rule and this deadly crackdown, these people are applauding for 5 minutes straight in support of the ethnic rebellions. And while this violence continues, while the relatives of the dissidents bury the dead, the junta insists security forces are, and these are their words, they are exercising utmost restraints. But the cries of the children seem to drown out those words. LG Electronics getting out of the cell phone business. The South Korean firm says there's just no money in it. In recent years, the company's cell phone division has lost billions of dollars. Once considered a pioneer of the Android operating system, LG's market share dropped to just 3% by 2018. It's been facing tough competition from emerging, cheaper Chinese rivals such as Huawei. LG says instead it's going to focus on growth areas such as electric vehicle components, robotics, and smart homes. That volcanic eruption in Iceland that we told you about a couple of weeks ago has entered a new phase. A new fissure has opened up and begun spitting out lava. It's about 200 meters long and about 1 kilometer from the first eruption. You can see it up there on the screen. Authorities have sealed off access to the site and begun evacuating sightseers as a precaution. Experts initially thought the eruption would just be a short-lived event. Now, they say it could last several weeks or more. Up next, we have stories from Panama, New Jersey, and Maryland. Eagle News America continues.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
It's time to take one step further and face the impossible. Time to search the unknown and fight for the truth. Time to overcome boundaries and connect the world. It's time for DW News.
Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net 25.
You're watching Eagle News America. I'm Thomas I. Likeness. In the Central American country of Panama, blended classes are set to resume in several schools. With the details on that, Eagle News correspondent May Davla.
The Minister of Education, Maruja Gordeta Villalobos, announces that on April 12, blended classes could resume. The decision was made in consensus with the Ministerio de Salud and by the COVID-19 school committees, guaranteeing the necessary sanitary measures will be applied. They will apply this progressive, phased, gradual, and contextualized process to schools with all the biosecurity norms. They are recommending that the first students be those of preschool, first grades, and graduating students. The Villalobos indicates that the start of classes will be by educational region and in areas where the rate of coronavirus cases are low. She says some schools in the provinces of Herrera, Los Santos, Cocole, and Chiriquí are ready. This process will be voluntary and progressive with the guidance and support of the Meduca. If a parent has doubts or the children have any medical condition that prevents them from going, the school will guarantee full support. In March 2020, classes were suspended due to the pandemic when the first reported death in Panama was a public school director. 2 other teachers from that same campus were among the first 8 positive cases. In July of the same year, classes were virtually restarted. This modality continued when the present school year started March of this year. Educators' unions said they would not return to schools until the necessary conditions are guaranteed to prevent infections, such as potable water in all schools and that all teachers have been vaccinated. Desde Ciudad de Panama, May Davila, Eagle News. Vivimos en tiempos interesantes.
We go to New Jersey now, where the vaccine rollout continues with those over 16 eligible for the shot now. Standing by in Sicklerville, Mayanne Manzano-Garzon, and as well as the news about immunization, Mayanne, I understand there are also some new travel guidelines. Tell us all about that as well.
That's right, Thomas, and thank you. Governor Phil Murphy today announced that all individuals ages 16 and older will be eligible to receive a COVID-19 vaccination starting April 19, 2 weeks ahead of the state's initial target of May 1. New Jersey's phased vaccination rollout has successfully administered 4.7 million doses of vaccine to essential frontline workers, educators, high-risk groups, and other eligible adults who live, work, or study in the state. Here is Governor Phil Murphy. Take a look.
Today is we are also going to make our most aggressive push yet to meet our vaccination goals, and I'm announcing that effective 2 weeks from today, so this is April 19th, all New Jerseyans age 16 and over will be eligible for vaccination. That's about 12 days ahead of our initial target that had been May 1st, but given the trajectory we are on, we believe this is the right time to put our program into higher gear. Before we flip off of this, again, I want to remind everyone of an analogy that someone had given to me when you board the airplane. We're not suggesting that everybody who wants one has got one, but we want to make sure that we continue these overlapping waves, and we believe we can responsibly move that date up from May 1st to April 19th, and at that point make this available to anyone who 16 and over. Today is
Another news, today New Jersey issued new COVID-19 travel guidance. The restrictions follow updated travel recommendations released by the Center for Disease Control, or CDC, earlier this month. Here is Judy Percy Kelly, Commissioner of the Department of Health of New Jersey. Take a look.
On Friday, CDC updated its travel guidance for fully vaccinated individuals. As a reminder, a person is considered fully vaccinated 2 weeks after receiving the last recommended dose of the vaccine. Fully vaccinated people can travel within the United States without the need to get tested or self-quarantine as long as they continue to take COVID-19 precautions while traveling, wearing a mask, avoiding crowds, physically distancing, and washing their hands frequently. International travel poses additional risks, and even fully vaccinated travelers are at increased risk for getting and possibly spreading new COVID-19 variants. Fully vaccinated travelers do not need to get tested before leaving the United States unless it is required by their destination. The federal government requires fully vaccinated air travelers coming to the U.S. from abroad to have a negative COVID-19 viral test within 3 days of travel or documentation of recovery from COVID-19 in the past 3 months before they board a flight to the United States. And these travelers should be tested for COVID-19 3 to 5 days after travel. Fully vaccinated travelers do not need to self-quarantine following international travel. Dr. Tan's team is working to update our guidance in the United States for travel. The recommendations for unvaccinated individuals have not changed. They should defer travel until fully vaccinated. If they must travel, they should get tested with a viral test 1 to 3 days before the trip and get tested 3 to 5 days after travel. It is recommended that they stay home and self-quarantine for a full 7 days after travel, even if the post-travel test is negative. If they are not tested after travel, they should stay home and self-quarantine for 10 days after travel.
And for New Jersey's latest COVID-19 numbers, the Department of Health has reported another 2,471 new positive cases today, bringing our statewide total to 817,464. Sadly, we are also reporting 15 new confirmed deaths, pushing the total to 22,081 fatalities. On the brighter side, the latest total of fully vaccinated people in New Jersey is now 1,796,798. And to know more about the latest on New Jersey's vaccination progress, visit covid19.nj.gov/vaccine. And for a quick weather update, Thomas, it's currently 10:01 in the evening here in New Jersey, and it's currently clear. It is 55 degrees Fahrenheit or 13 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to you, Thomas.
You know, up here in Canada, that temperature at that time of day, well, that's a virtual heat wave. Anyway, you're making remarkable progress in your state on vaccination, something I wish we were doing up here. But we do share the same problem as in both jurisdictions. Vaccine hesitancy. What about those who don't want to get the shot?
Well, it's interesting you asked, Thomas, because actually, according to state officials during the COVID briefing earlier today, the number is actually less than what they feared. That is actually, according to Governor Phil Murphy, and the Department of Health is doing a survey every 2 weeks, and the commissioner reported that hesitancy decreased significantly. She reported that from the percentage of those who want to get the vaccine has grown from 40% initially, and it's now 70%, Thomas.
Well, that's good to hear, because to achieve herd immunity, you're going to have a majority of the population vaccinated. What is the state's goal in its vaccination program?
Well, Thomas, I think it's the same across the nation, no? The state's goal to vaccinate is 70% of its eligible adults, and about 4.7 million people out of 9.6 million residents here in New Jersey. And that is by the end of May. That's the target by the end of May. And as per latest report, Thomas, 24% of the state's 6.9 million adult residents have been fully vaccinated already. Thomas?
Well, that's pretty good. 1 out of 4. Oh, before you go, quickly update us on recommendations for all travelers.
Well, Tom, as part of the report, Judy Persicelli mentioned about the recommendations on fully vaccinated and non-vaccinated, but this is the general rule for all travelers. These are the guidelines. For international travel, negative test result or documentation of recovery required by the CDC to enter United States following air travel. And you should self-monitor for symptoms during and after travel and self-isolate if symptoms develop. Also wear masks over your nose and mouth when in public, avoid crowds, and stay at least 6 feet from others. And lastly, wash hands often or use hand sanitizer. Thomas?
Good advice, Mayan. You take care, and look forward to chatting with you a little later on in the virtual roundtable segment of our program.
Sure, Thomas.
Marylanders over the age of 16 can now be vaccinated for COVID-19. Eagle News correspondent Arlene Ocampo is in Fort Washington, standing by to tell us. Thank you for joining us this evening, Arlene.
Good evening. Thank you, Thomas. With the accelerating vaccination rate and the increase in vaccine supply, Maryland Governor Larry Hogan announced that Marylanders 16 years old and over can now pre-register to receive the COVID-19 vaccine at any of the mass vaccination sites. One can visit covidvax.maryland.gov or call 1-855-MD-GoVax to register. Individuals who are eligible under Phase 1 and Phase 2 will continue to be prioritized for their appointments. Vaccinations are being administered in many platforms here in the state of Maryland. This includes the 24 local health departments, 38 hospitals, some of the pharmacies, and the mass vaccination sites throughout all regions of the state. Here are the updates of the opening of the additional mass vaccination sites. This week, Montgomery College in Germantown, Maryland, and on Wednesday, the Greenbelt Metro Station here in Prince George's County will be converted primarily to Prince Georgians as a FEMA-operated site. The Timonium Fairgrounds in Baltimore County will open this week as well. Next week, the Navy Stadium in Anne Arundel County and Frederick Community College in Frederick County will be converted. The week of April 19th, the Ripken Stadium in Hartford County will open as another option. And lastly, Columbia Mall in Howard County will open the week of April 26th as another mass vaccination site. There are many options that are available to us to obtain the vaccine. We just have to be patient and waiting for our turn. In the meantime, let's continue to stay vigilant out there as there are concerns regarding the variants that appear to be moving here in the East Coast. Governor Hogan mentioned that we are in a race between the variants and the vaccine. Our best defense is to get vaccinated. In Fort Washington, Maryland, Arlene Ocampo, Eagle News, we live in interesting times. Back to you, Thomas.
Arlene, I heard there's additional information for those 16 and older. Can you expand on that for us?
Yes, thank you, Thomas. In a press conference today, Governor Hogan mentioned that starting tomorrow, those 16 and older, they can actually get their shots at the state's mass vaccination site. And then next week, every vaccine provider in the state can actually offer the vaccine to those within that age group as well. And also with that age group, the 16 and the 17-year-olds, they can only get the shots that are at the sites offering the Pfizer vaccine, since this is the only vaccine that is approved for those within that age group. Thomas?
Before you go, what's the status of the vaccine distribution there in Maryland?
Here in Maryland, there's 1,123,257 that are fully vaccinated. 2,993,827 doses have been administered, so almost 3 million. And then 61,331 doses administered each day on average. Thomas?
Sounds like the rollout is doing well. Arlene, thanks for joining us, and do take care and stay safe.
Thank you. Likewise.
Still to come, we have stories from Pennsylvania, Nevada, and California. This is Eagle News America.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced, not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Aguila Pilipinas. A one-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Aguila Provincia.
Sa mga taga Iloilo at
Tune into Mata ng Agila, the evening primetime news program of Net25. Balanced and objective, Mata ng Agila covers national and international issues, tackles news on business, health, science and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to explain our help outdoor.
Catch these programs on Net25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel.
Innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Your weekly dose of entrepreneurial inspiration to update you on the latest developments in the world of business. Get up close and personal with CEOs and thought leaders to help you discover valuable insights, sharpen your instincts for smart decision making with the latest markets and economic trends, disruptive ideas, global innovation, social entrepreneurship, and other leading-edge business ideas. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business, from vision to action.
Watching Eagle News America, I'm Thomas I. Likeness. In Pennsylvania, more people are eligible for the COVID vaccine. We go to Swarthmore now, where EBC's Mila Simbulan is standing by. At what stage is the vaccine rollout, Mila?
Hi, Thomas. Oh, good evening, Thomas, and good morning to all our viewers from the other side of the world. Yes, we're now in Phase B, and the wait is finally over for those eligible Pennsylvanians for Phase 1B. Starting today, Pennsylvanians in Phase 1B of the state's vaccination plan are now eligible to schedule a COVID-19 vaccination appointment to become protected against the virus. Phase 1B eligible Pennsylvanians include people in congregate settings not otherwise specified as long-term care facilities, and persons receiving home and community-based services, U.S. Postal Service workers, manufacturing workers, clergy and other essential support for houses of worship, public transit workers, and education workers. The remainder of the accelerated plan includes eligibility as follows. On April 12, all residents in Phase 1C will be eligible to start scheduling vaccination appointments, while on April 19, all residents will be eligible to start scheduling vaccination appointments. According to the CDC, as of Monday morning, April 5th, Pennsylvania has administered first doses of vaccine to 34.8% of its eligible population, and the state ranks 12th among all 50 states for first doses administered by percentage of population. Pennsylvania also ranks 5th among all 50 states for total doses administered, Vaccine providers have administered 5,632,986 total vaccine doses as of Monday, April 5th, while 2,010,955 people are fully vaccinated. With a 7-day moving average of more than 90,000 people per day receiving vaccinations, 1,744,647 people are partially vaccinated, meaning they have received 1 dose of a 2-dose vaccine. 3,755,602 people have received at least their first dose. Meanwhile, here's the current COVID-19 numbers here in Pennsylvania. The Pennsylvania Department of Health today confirmed as of 12 a.m. April 5th, there were 2,718 additional positive cases of COVID-19, in addition to 3,933 new cases reported Sunday, April 4th, for a 2-day total of 6,651 additional positive cases of COVID-19, bringing the statewide total to 1,045,400. There are 2,202 individuals hospitalized with COVID-19. Of that number, 432 patients are in the intensive care unit with COVID-19. Most of the patients hospitalized are ages 65 or older, and most of the deaths have occurred in patients 65 or older. The trend in the 14-day moving average number of hospitalized patients per day is about 4,200 lower than it was at the peak on December 25th, 2020. The current 14-day average is also below what it was at the height of the spring peak on May 3, 2020. However, the moving average of number of hospitalized patients has started to increase. Statewide percent positivity for the week of March 26 to April 1st stood at 9.4%. Right now, Thomas and Swarthmore, it's 64 degrees Fahrenheit or 17 degrees Celsius with cloudy skies. In Swarthmore, Pennsylvania, Milo Simbula and Eagle News, we live in interesting times. Back to you, Thomas.
And that's definitely a heat wave. There's 74.
I know.
And what time is it there? Quarter
Aren't
after
you
10?
jealous? It's currently it's 10 o'clock, 10:15.
As soon as I get off the air here, I think I'm going to pack my bags and we'll move. Anyway,
Yes,
I want to get a handle on the timeline of the rollout there. When did phase 1 start in Pennsylvania, and how long did it take to move to 1B?
So the Pennsylvania hospitals began receiving shipments of the Pfizer-BioNTech COVID-19 the week of December 14, and Moderna, it was the week of December 21st. So if we're going to count January, 3 months, you have to wait. Those on phase 1B have to wait 3 months for them to start planning for their vaccination.
How can people check if they're eligible for phase 1B?
So, Thomas, there is you can check it online. There's on the Department of Health, they have a website called Your Turn PA on its COVID portal. So it's a tool to determine if it's your turn to receive the COVID-19 vaccine here in Pennsylvania. And if it's not your turn yet, that means you're in phase 1C. So I even tried using that website actually, and just for the heck of it, and it keeps on actually for the 3rd time it keeps on telling me it's not your turn yet. You're supposed to be in phase 1C. So it's really cool tool because if you're eligible to receive vaccination, let's say you're in phase 1B, they will also provide you with providers or locations where you can get your vaccination depending on where you live. Thomas?
I would imagine you're getting a little closer to the front of the line. What phase are you in, Mila, and when can you schedule your vaccination appointment?
Actually, I'm part of the rest of the Pennsylvanians, and we were informed that which is phase 1C, and we were informed that phase 1C will start on April 19, which is really close though. I thought, it will still be around May time where we will get our vaccination. So yeah, we're getting there. Thomas?
Well, hang in there and stay safe. And looking forward to chatting with you a little bit later in the program. Thanks again, Myla.
Looking forward to
Mobile vaccine clinics are being dispatched to rural Nevada. And joining us live from Las Vegas to tell us all about that, EBC's Anna Cui. Anna, this is certainly going to improve access for people living in those far-flung areas.
Exactly, Thomas. You know, because as we've all been hearing from public health experts, there is this race between vaccines and variants, right? So, and all the states are doing everything they can possible to get ahead of the variants, of course. So it's good news here. The state of Nevada, along with the Federal Emergency Management Agency, or FEMA, along with local partners and tribal leaders, launched these 2 mobile vaccination units to support equitable distribution of the COVID-19 vaccine in rural and tribal areas where, you know, obviously there's limited medical infrastructure there. So the mobile units arrived in Nevada on Saturday, and their first vaccination event will be this coming Tuesday. According to the Nevada Health Response, you know, some of the Nevada counties don't have enough vaccination sites or even vaccinators. So these FEMA mobile vaccination units will be making 13 stops on northern route throughout the month of April, with additional stops in southern rural communities. Now, the mobile units will be offering the one-shot Janssen vaccine. Makes sense, right, Thomas? They want to, you know, do a one-time, one-done, and will be provided to walk-up registrants on first-come, first-served basis. Janssen, of course, the Janssen vaccine is available to those 18 years and older. Now, this news comes as the eligibility for the vaccine is expanded in the state to healthy adults 16 years and older starting today. So that's another exciting news, and that will also help even more in distributing the vaccination. Additionally, you know, there's also programs that the Clark County have developed to also support equitable distribution. They have a homebound vaccination program as well as for the homeless population. So these are people aged 18 years and older who are not able to get out of their house because of medical condition, or maybe they need medical equipment to leave their home, they're bedridden, and then of course the homeless population. For more information, people can call 800-401-0946 to avail of that service. Now, another challenge, you know, that they also addressed sometimes, people, especially among the 65 years and older population, the problem is getting to the vaccination site. So the Southern Nevada Health District and the Regional Transportation Commission have coordinated to provide free service that would allow qualifying individuals 65 years and older to receive a free ride from their home. Although it's only limited, it's only to the Cashman Center. It's one of the mass vaccination sites here in Clark County in order to receive the vaccine. In fact, Thomas, I checked into it. Those who have transportation benefits through their Medicare Advantage plans can also avail of that service to get their vaccination. In Las Vegas, Anna Cui, Eagle News, we live in interesting times. Back to you, Thomas.
Anna, let's focus on your city, Las Vegas. Can you give us an update there on what the vaccination rate is there?
So here in Clark County, Thomas, I don't mean to make you feel bad. Last night you reported on a milestone, right? You reported on a milestone there in Canada with the number of cases. Well, here in Southern Nevada, they reached a 1 million milestone, a milestone reaching 1 million doses of vaccine.
And that's a milestone you really want to brag about. Ours, we just wish it didn't happen.
Yes, Thomas. Well, soon. I'm hoping your numbers will definitely get better.
We hear of cases rising in some states. How about there in Nevada?
Well, so according to the state dashboard, Nevada as a whole is showing a 12% increase in cases as of today. But, you know, interestingly enough, the hospitalization rate and the number of deaths continue on decline. Here in Clark County, the number of cases, I checked today, the dashboard, it's actually at 198 per 100,000. And that is the first time that I'm seeing that number less than 200. And I'm sure, again, the vaccination rate and the vaccination rollout here has a lot to do with that. Thomas.
And that's certainly good news because, again, you're going to be inundated as soon as things begin to open up more. You're just going to be inundated with all kinds of people there, Vegas being a tourist destination. And speaking of traveling now, you've been fully vaccinated. How do you feel about traveling at this point?
Well, even if I wanted to travel long distance right now, at this time, I can't really travel too far due to, my church obligations. But I wouldn't mind going on short trips, maybe like California or Utah. And then, of course, we heard about the recommendations with CDC, right? I mean, first they say if you're fully vaccinated, as long as you wait 2 weeks, you can travel. And then at the same time, they say, they really not advising people to travel still yet.
Yeah, there's one unknown there that a lot of people don't talk about a whole lot. You might be fully vaccinated and you might be immune, but it's still not known whether you could go to a place where there's a high incidence of COVID and become a carrier of the disease without being infected yourself. And that's something that's troubling to a lot of healthcare professionals.
Exactly. So I'm just going to stay put for now, Thomas.
Okay, and stay safe and stick around because we'd like to get your thoughts at the end of the program on the virtual roundtable. Well, there's no doubt the pandemic has taken a toll on the mental health of people, especially college students. Eagle News correspondent Ivan Sanchez III joins us now from California to tell us about a study showing college students are experiencing anxiety and depression. What other findings are in this study, Ivan?
Thank you, Thomas. So, a recent study done by several psychological professionals written in the Public Library of Science on college students reported that over 70% of students have experienced some form of anxiety and depression this year. Students have also noted their over-reliance on technology and phones, as 80% of students reported their phone and computer screen times to be over 6 hours a day. Counseling departments of universities across the country have made efforts to reach out to students in these stressful times. Popular programs that students can take together virtually include exercise and mindfulness sessions. Many students have also found comfort in reaching out to their counselors or peer mentors to talk about life's problems. Although times have been difficult, brighter days are ahead. In California, educational institutions such as the University of California and the California State University systems have announced their plans and commitment to make sure a majority of classes and events will be held in person next fall. Returning to campus, however, will most likely require a COVID-19 vaccine and some form of social distancing or masking. So while students are still at home, researchers at St. Edward's University say students can do many things to stay mentally healthy, spending more time outside, showing gratitude each day through journaling or keeping in touch with close friends and family have positive psychological benefits. It is no secret that college students face great struggles while pursuing an education, and these struggles have become greater during the pandemic. Many students, however, are looking forward to a sense of normalcy by going back to school in person, where lifelong connections can be made and opportunities for success and growth can be found. In Lancaster, California, Ivan Sanchez III, Eagle News. We live in interesting times. Back to you, Thomas.
Ivan, you're a college student, and from what you're telling us, attending college in an online format can be a challenge. Could you tell us what are some of the struggles that you or your friends have faced while taking college classes from home?
I can, Thomas. A challenge that lots of us have faced is staying on top of our work, which seems to pile up faster than before. Since all of our work is done on computer screens, it could also be draining to talk to friends online as well. Thankfully, my conditions at home are good, in the sense that I have a stable internet connection, and I can always rely on my parents to not distract me while I'm in class or I'm presenting. Thomas?
For a student like you, Ivan, I would imagine that doing schoolwork is not the only thing on your mind. What are some of the hobbies, some of the activities that you do outside of school to stay motivated or even, just to stay mentally balanced in these times?
Thomas, although I like watching TV on the weekends, I try my best not to be on the screen so much. So after school, I try to make an effort to branch out into creative writing and reading and exercise. It also really helps me to recharge and help set personal goals for myself. Thomas?
Sounds like great outlets to relieve the stress, Ivan. Now, I remember you mentioned that online college, well, of course, it's not going to last forever, and soon you're going to be back in the classroom. Are there new things that you've picked up or new routines that you've adapted so that, you know, when you're back in the classroom, when you're ready to go back to the campus, you will be ready? What have you done to prepare yourself to resume classes on campus?
Oh, well, some things that I've been trying to do is like take care of my sleep schedule, because like when we go back in person, I don't want to be late to class because I overslept or be exhausted during class because I didn't get enough sleep. And I've also tried to connect with my friends more on campus and around me so that when we go back to school, I'll have a social circle to turn to and rely on. And I also hope to buy some kind of form of transportation, like a scooter or a skateboard soon, as college campuses are large, and I'm not going to be able to just log into class anymore. So I don't have a specific plan in mind yet, but I know I am ready, and I am excited to come back to campus.
Well, the best of luck to you as your classes resume, and look forward to talking to you in a few minutes on our virtual roundtable. Thank you, Ivan. Up next, some recommendations for safe outdoor activities and a virtual roundtable. You know, it's National Flash Drive Day, and tonight we'll talk about how this device has changed the way we handle important files. You're watching Eagle News America.
In good shape. Isn't that how we'd all like to be? But how can you be truly fit? And how can you stay truly healthy right up into your golden years? And truly have fun while doing it.
In good shape.
Start up your weekday mornings with edutainment, news and information kasama ang inyong paboritong Net25 shows. Samahan ang inyong paboritong morning barkada sa Pambansang Almusal at 5 a.m. Tatalakayin mga pangunahing balita sa pagtutulungan ng Radyo Agila at Net25. Samahan si Weng de la Fuente sa Balitalakayan, 7 a.m. Saganang Mamamayan at 8 a.m. NHK World at 9 a.m. Eagle News International at 10 a.m. At mga balitang dapat niyong malaman mula sa Agila, Pilipinas at 11 a.m. This is your morning startup every weekday mornings only here on Net25.
This is Eagle News America. I'm Thomas I. Likeness. Well, spring has sprung, and we're all spending more time outdoors. We all want to be around other people while we're outdoors. Eagle News correspondent Susan Husk reports from Dallas, Texas, on the Center for Disease Control's recommendations for safe outdoor activities.
Thank you, and howdy from the Lone Star State. With the spring months bringing warmer weather, now is a great time to practice healthy habits while enjoying outdoors. According to the Centers for Disease Control, outdoor activities are the safer choice when planning solo or group activities and will produce less exposure to COVID-19 even without the use of facial coverings or masks, as long as you stay at least 6 feet apart from people who don't live with you and limit your time around others. The CDC website shared the following examples of springtime activities you can safely do to stay healthy while limiting exposure to COVID-19. Try walking or jogging or biking at your neighborhood park, taking time to appreciate nature while hiking on a trail, taking your dog for a walk around the neighborhood, participate in an outdoor exercise class, doing garden work, walking around the mall during off hours, and swimming at your local pool. Other examples of outdoor activities to do while spending time with people who don't live with you are having a picnic at a park, playing kickball in a friend's backyard, roasting marshmallows around a fire pit, hosting an outdoor barbecue, going to a drive-in movie, listen to an outdoor concert from your car, or creating your own outdoor movie party. For more tips on safe outdoor activities, visit cdc.gov for details. Meanwhile, I hope you are enjoying the warmer weather in your part of the world. In Dallas, Texas, I'm Susan Husk, Eagle News. We live in interesting times. Back to you in the studio.
Well, it's time now for our virtual roundtable and the topic, National Flash Drive Day. And why today, do you ask? Well, that's because on April the 5th, in 1999, 22 years ago, the inventors of this device filed their patent. And incidentally, at that time, it was called the flash disk. And it changed the way we stored data. It's, extremely portable. No longer did we have to ensure our clients had the same type of disk drive as our data was on. And these things are huge, not in size, but in capacity. Now, there are some you can store up to 2 terabytes of information. I'm going to forget most of my preamble here because I want to find out from people, what do you use your flash drive for? And I've got one other question for you as well. First of all, what do you use your flash drive for? But secondly, now, if you found one of these on the floor like this and you picked it up, what would you do with it? Would you look at it to see what's on it? Would you plug it into the USB on your computer? I'm curious as to how curious you are. Let's start with you, Anna. What do you use a flash drive for?
Honestly, I haven't used one lately, but I do have. I'm going to show you. This is one of the reasons why I miss conventions, because I get to pick up these free USB.
Oh, yeah, all the swag, yeah.
But I used to use more of them when I was going to school, right? To save things, to save files. Now I should probably give these away. Thomas.
Okay. Marianne, what do you use a flash? Oh, before you go, if you found one of these on the floor, what would you do with it?
I'd probably want to check out what's in there.
Okay. Marianne?
Well, Thomas, I remember it was mind-blowing when I switched the flash drive from my floppy disk in high school. It was mind-blowing during that time that because, Thomas, anything storage that is compact and handy, it's a blessing, And I remember I used to have 2 in 2 or 3 in college. I remember one is for personal, like pictures, photos from my phone, and 2 would be for school, Thomas.
And if you found one on the floor, what would you do with it?
Oh, yeah. I would be tempted like Anna, but I guess I won't. I'd be too lazy also to check, so I'd probably just toss it.
We go to California now, and Ivan. Flash drives, what do you use them for? And if you found one, would you check it out?
Well, Thomas, unfortunately, I have not used a flash drive in a long time because of the platforms such as like Google. It just makes it much more convenient to store like all my stuff like related to like slides and documents. But if I did find one on the floor, I'd feel guilty about it because that's not my business, but I would take a glance of what's on there.
Okay. And Mila, you get the last word. What say you?
So Thomas, I could not remember the last time I used flash drives because now everything, all my files are in the cloud. So there's no use for me to use a flash drive. But just a trivia, the first storage device was the punch cards. I don't know if you remember what punch cards are.
I used punch cards.
Oh, really? Wow.
Yes. Back in the days of Fortran and APL.
I don't know anyone who used one. Yeah. That's great. Yeah. So yes, that's a really cool. It's not that cool device, but it's the part of the storage, and it's only 0.08 kilobyte for one punch card, and it only stores like probably one line of information. But anyway, yes, if I find a flash drive on the floor, it depends on where I found it. If it's inside my house, all the flash drive, I own it here. They only borrow it from me just to, move things from one device to another. My kids do that.
So if you found one, would you look at it?
Yes, because that's probably my long lost flash drive. There's probably
no. I mean, if you found one elsewhere.
Like that. But if it's a different house, or if it's somewhere else, I probably won't look at it because I don't know. I'll be scared. You don't know what you're going to find.
Exactly. Good advice, because you don't know what's on it if you don't own it. Could be a virus. You end up infecting your computer. We got to bail out of here. Incidentally, I like them for music in the car. You can put a huge playlist on there. But one thing I want to do before we leave tonight, let's salute our frontline workers. I'm talking about our healthcare workers, first responders, essential workers of all types. Let's give them a round of applause. We appreciate you, and that's tonight's Eagle News America. Thank you for joining us. I'm Thomas I. Likeness, and truly, we live in interesting times.